Hi everyone. We'll start with the welcome message. So, can you please, Naveen, please? Hi
Welcome to
everyone.
Yellow
We'll
Belt
start
Training.
with the welcome message.
You can only
So,
stay ahead of
can you
competition by
please,
putting your best foot forward
Naveen,
and by
please?
enhancing your skill set. Similarly, organizations need to put their best quality forward in order to stay ahead of competition. Be
Welcome
it
to
in
Yellow
terms of
Belt
products or
Training.
services
Welcome
or
message.
customer.
So, some more people are joining in. So, we'll
Six
just
Sigma in both your personal and professional life and will set a strong foundation for further levels. In this 2-hour session, you will learn about the tools and techniques that Lean and Six Sigma Black Belt use, some concepts of Lean and Six Sigma, real-time projects, and how Lean Six Sigma is applied to them, and a lot more. We are sure that after this training, you will see the world with a fresh pair of eyes. Join us in this Yellow Belt session and become well versed in the foundation elements of Lean and Six Sigma methods. Become capable of assisting in improving processes. Improve your skill sets to become a part of the team focusing on complex improvement projects led by green or black belts. Apply DMAIC, DMAC in your work and push your boundaries to do better in every process you are a part of. Once again, welcome to Anexas Yellow Belt Training. I've designed this training based on my 32 years of experience in the industries, both in manufacturing and services. So once again, welcome to the Yellow Belt Training.
I welcome everyone. Welcome to the introduction to Green Belt Training, which of course you can call yourself. After this, if you are getting introduced to Green Belt, then you can always call yourself as a Yellow Belt certified, and that's what we plan to do, and that's what we intend to do. So once again, welcome, and I see there are. Some people and my team can tell me, are there more people expected?
Yes, sir, they shall be joining.
Okay, so okay, great. Till the time, I would maybe we can ask you to share your locations, and also you can tell me about what you do. And as more people will be joining in, I will you can answer some questions, and till then I will maybe spend maybe 5 minutes to introduce ourselves to you, and based on that I'll be happy to uh, yeah, so please answer some of the questions. Great. And so I see many of you are from manufacturing and healthcare and hospital. Some people are from logistics also, and some people are from maybe very few from IT. So you are in Mary, you are from okay, healthcare quality and accreditation. Great. And the second question, which department you belong to? So accordingly, I will choose my uh, examples also. Okay, great. So I see a lot of people from quality as well, and many of you are from operations also. And uh, yes, And the next question. Yeah, so this I just want to know because I can tell you how much percentage increase you can get if you, right now this is more like an introduction to green belt training and how you can become a green belt. But if you do become a green belt, in that case, how much salary rise you can expect. So those who are in the first range, they can easily expect 3 times minimum salary of a green belt certified person is 20,000. And above that, so once you get certified as a green belt, and if you do a project, then at least minimum salary, starting salary is 20,000. And then, of course, depending on where you are, accordingly, you can see the percentage. Those who are already in the range of 15 to 30%, they can expect 15 to 30,000 uh, AED. In that case, and they can expect at least 25% jump to 30% jump in their salary levels. So, yeah, so, and if you are above 30,000, then maybe depending on which position you are in, you can still expect 5 to 10% increase in salary after a green belt certification. So I hope my voice is clear. My throat is not so good today, so I'll try to keep the mic as close as possible to my mouth, and just let me know in case you find it difficult to hear me. Uh, Typically, my energy levels are much higher, but because of the bad throat, I'll try to act like an energetic person today. Yeah, yeah. So we can now close the poll, and let me introduce you to the company, and uh, then I'll talk about what is Lean and Six Sigma, what are the benefits of Lean and Six Sigma, and then I'll introduce you to Lean and Six Sigma. Then I'll tell you who's a green belt, black belt, master black belts, and how to identify the structure of the Lean and Six Sigma, how to create an infrastructure of Lean and Six Sigma. And after that, we will go through the DMAC phases. So if you claim that you have been introduced to a green belt session as a Lean and Six Sigma green belt session, you should be able to tell the people that what is DMAC. DMAC means define, measure, analyze, improve, and control. And these are the 5 phases of any project. Now, when you do a project, and what is a project? What is the basic definition of a project? The basic definition of a project is that it has a starting point and it is an end point. It doesn't exist after some time. So you are doing projects to improve a process. What is a process? Process is something which is repeated over a period of time, continuously over a period of time. You keep repeating whatever activities you are indulged in on a day-to-day basis. That is a process. So process is repetitive in nature, and project is one-time endeavor. So when you want to improve something in your organization, you will do a project. You will always do a project in a process. We'll see some applications in the industries, depending on which type of industry you are in. I got some idea that many of you are from healthcare and manufacturing. So I'll try to take examples of both. We'll be balanced. And my team can tell me that the time limit of our training session, and also some extra, if I want to take some extra, if I can take it, my team can write in the chat box as well. Introducing yourself. Okay. I think you can introduce yourself in the chat box. You can write in the chat box. What do you do? Which organization you belong to? Meanwhile, I will introduce myself, and a formal welcome to everyone with this video. My team can tell if they are able to hear this video audio.
Hi, welcome to Anexas, Anexas has been consulting and training the professionals in the organizations around the world since 2006, and we have trained more than 150,000 people and consulted for more than 500 organizations, which includes Fortune 100 organizations too. I'm Amitabh Saxena, and I have designed this program based on my 30 years of experience while working in various industries across many domains. The whole Anexas team once again joins me in welcoming you.
Okay, so on behalf of all the team members behind this session, which you are seeing today, there are almost 45 team members who are making this it possible to reach me to reach you. About the organization, we have been around for the last 19 years, and uh, as a trainer, I have been conducting training programs for the last 30 years. Total 35 years of experience I have, and 150,000 people I have trained in the last 25 years. I'm a chemical engineer and also an MBA. I'm also an amateur poet, and I completed my black belt certification by paying a lot of money during those days. In 2002, I became a black belt and a master black belt, and after that, since then, I have been conducting lots of training programs and also guiding lots of organizations around the world in Lean and Six Sigma. I'm a data scientist, also PMP and CPHQ. I do conduct CPHQ training sessions also. I see a lot of people from healthcare. They can take the advantage of that. I also conduct a introduction to CPHQ as well. So if you are interested, you can also write to us. And I'll be happy to enroll you for that program also. Project management also, I conduct the training program, and overall 35 years of experience. I just add one more year because we have just entered 2025, and of course a very happy new year to everyone. And consulted for many organizations and done lots of projects in almost all domains: manufacturing, services, IT, logistics, banking, everything. You too can achieve all this and much more. And today you are learning not only from me or from my experience, but also from what my students have achieved and what they keep teaching me as well. Some of the photographs just to prove that we have been conducting training programs worldwide. These are all my students spread around the world. I also take pride in telling that I had conducted the first ever black belt training program in whole of Middle East. In whole of Middle East. It was covered in the newspapers, and it was also covered in the TV channels too. So that program, I still remember 2006 and 7, the first ever black belt training program conducted in Riyadh. Europe, Australia. I'm a resident of Australia, but most of the time you'll find me in Middle East because most of my clients are in Middle East. Some awards also we have won. Also appeared on TV shows, and this is the business show where I had
certified black belt from Anexas. All the best. Thank you.
And American Society of Quality also I have spoken times.
On 21st of May 2019,
So this year, actually, I talked about how Lean and Six Sigma can reduce the nosocomial infection in healthcare patients. And also last year, I had spoken about how an oil industry reduced the rig move time. And how before that, how a manufacturing company improved the production by 30% without investing in any new equipment. But there's a lot of waste in our processes, and all of us can always improve that. Improve our processes and reduce the costs and improve the profits by applying these tools and techniques, which we are going to learn. Last thing, just to tell you, we have got some very famous personalities in Middle East who have been our clients. Deputy Health Minister Dr. Tarif Alama and now Dr. Muhammad Abdul Ali. They are all our client, have been our attendees of our training programs, and they have also done the projects as well. So these are some of the credentials I just wanted to share with you. I think now I have established my credentials, and I see some 20 people have joined. I think that's the only people we are going to have today. So uh, fine. So in this case, we can open the panel. We can open up the panel, and we can invite everyone to join so that they can see also, they can participate, they can write. Okay, or let it be, I think, because we have put it in a webinar mode. So I can see your comments, but not everyone can see your comments. I'll keep replying. My team can keep replying to your questions in the chat box. Okay, can you tell me what is the similarity here? What are the similarity you see here? A manufacturing company improves production by 30%. A hospital reduces discharge time of patients from some hours, like long hours, to less 3 hours, to 15 minutes, and the 64% reduction in recruitment time in multinational organization, etc. So can you tell me what are the similarities here? What do you think is similar? Bank is reducing the errors. Insurance claims time is reduced by 70%. Yeah, so many of you have given the right answer. All of them are about improvements. Yes. Naveen is telling that less time for completing a job. Yes, absolutely. Naveen, you're right. And yeah, so most of you are right. And all of them, in fact, are Six Sigma projects as well. So they are all, Jabideen is telling reduce the time. Yeah. So you're right. And all of them, all these projects are uh, all of them actually yeah, are the Six Sigma projects. Uh, I'll just uh, I'll just restart my laptop. Meanwhile, let me, because many of you are from healthcare and manufacturing as well. So let me play two videos: how Lean and Six Sigma can help healthcare, and how Lean and Six Sigma can help the manufacturing. And I'll just restart my computer, and I'll be back. Are you able to hear me?
Hi, I am Anexas Master Black Belt Amitabh Saxena, and let me talk about importance of Lean and Six Sigma in healthcare. Lean Six Sigma concepts are used in industries all over the world to improve a process, eliminate waste, and reduce defects. In the healthcare industry, defects not only affect revenue and customer satisfaction, but they signify the difference between life and death. Lean Six Sigma is critically important in healthcare because it helps in reducing defects that can result in medical errors. There are so many challenges in the healthcare industry, like an aging population, shortage of workers, increasing litigation, and many more that require long-term improvement. Because healthcare industry deals with saving lives, errors cannot be accepted at any cost. So, how does Lean Six Sigma really help? With the help of Lean Six Sigma, you can shorten the waiting times in hospitals. The lesser the people wait, the efficient the hospitals will become. Reduce medication errors and even try to completely eliminate them. Improve turnaround time for lab results. provide better care at lower costs, ensure that the medical staff makes fewer errors, reduce mortality rates, improve patient care, improve quality, and improve overall patient experience. How can you do that? By training the staff as green belts and black belts and allowing them to do improvement projects. Lean Six Sigma training and certification in healthcare provides the tools needed to address the challenges at various levels. It is a time for the healthcare industry to utilize Lean Six Sigma methods to its fullest and drastically change the healthcare industry for the better. Don't you want to be a part of the industry where patients are happier, physicians want to work for you, the cost is as low as possible, and at the same time efficiency is high? If your answer is yes, then Lean Six Sigma is your choice. We have implemented Lean Six Sigma in more than 25 hospitals worldwide, including ministries of health of 4 countries, and we can help you too. The world we have created is the product of our own thinking, and we cannot improve the world without improving our thinking. The long-term chronic problems of manufacturing companies like low productivity, lower machine efficiency, high rework, high inventories, high product wastage can't be solved using only experience, logic, and intuition. You might be a good operations person, a good engineer, or an excellent operator, but you need to have basic knowledge and understanding of some problem solving and process improvement tools too. Here is how Lean Six Sigma can improve your processes in manufacturing. Lean Six Sigma is defined as a business improvement method that aims to maximize the shareholders' value by improving the quality, speed, customer satisfaction, and reduce the costs. It merges tools and principles from both Lean and Six Sigma to do this. It has become the most popular business strategies for deploying continuous improvement in the manufacturing industries. With its help, you can make sure that only essential steps remain in a process. The moment I say Lean Six Sigma techniques, high quality, low cost, increased profits, and customer satisfaction should automatically come to your mind. It is very rightly said that machines are mere pieces of metal if they cannot be made efficient. Lean Six Sigma helps you to do this. What is the core of Lean Six Sigma? It's DMAC. Yes. Define, measure, analyze, improve, and control. It helps you to reduce the existing problems with unknown causes. Here we train the staff of the manufacturing units as the green belts and black belts, and they convert all the problems into improvement projects. So now the difficulties become opportunities. Then they complete these projects and get certified. It's a win-win for both the organization and the employees. Now, how does Lean Six Sigma decrease the cost? Shijo Shingo said that the most hazardous waste is the waste that we do not recognize. Firstly, Lean Six Sigma focuses on removing the 7 wastes like overproduction, transportation, inventory, etc. from a process. In manufacturing sector, this step can lower the cost of a process by leaps and bounds. Secondly, Lean Six Sigma focuses on solving the problems caused by a process. Here we focus on the processes, not on people, because we believe that 85% of the problems are due to the processes and not due to the people. Defects in your product can cost your organization a fortune, so the focus is on reducing the defects by focusing on the processes. Let me talk about some Lean Six Sigma tools that can be used in manufacturing. Value stream mapping, Kanban, 5S, cause and effect analysis, control charts, DMAC, 5 Whys, Kaizen, hypothesis tests, etc., etc., etc. Let us talk about a few. 5S. A well-organized workplace becomes important if you want to eliminate waste and reduce the errors. 5S is the way to do that. Control charts. By understanding the control charts, you can understand the difference between the common causes and special causes. For special causes, you take immediate action, and for common causes, you take long-term actions. Kanban. It is a visualizing tool on maximizing the flow of goods and work without unnecessary inventory or transportation. Then we have 5 whys. Ask why 5 times and you will get to the root cause of the problem. Hypothesis tests. They establish the relationship between the outputs and inputs, and you can get the root cause with 95% confidence. Value stream mapping. It is used for defining and assessing the movement of the raw materials from the beginning of the process to delivery to the customer. It is a way in which the current state of a process is documented and the future state is visualized. If you want in-depth knowledge about all the tools and techniques, you can always join my Lean Six Sigma Green Belt and Black Belt training programs. So that was about Lean Six Sigma in manufacturing. I hope you have got a clear picture about why Lean Six Sigma is so important in the manufacturing industry. Share this video with your friends and don't forget to subscribe to our channel if you don't want to miss out on our important updates on the tools and techniques of Lean and Six Sigma and even project management. Happy learning!
Now you saw how Lean and Six Sigma can help both the industries, healthcare as well as manufacturing. Now, when we are looking at, I think I'm not able to share the sound. If you can please make it. The videos, I'm not able to share the sound. Can you make me? Okay. So as I was talking, so we are now into the, now we have already introduced ourselves and many people have joined in. Now let us start. So what Lean and Six Sigma can do? See, what Lean and Six Sigma can do for all industries. It can reduce the costs, reduce the defects, reduce the waste, reduce the rework, reduce the cycle time. And it can also improve the quality, production efficiency, productivity, customer satisfaction, capacity, profitability. And which CEO would not love a person who can achieve all these things? So Lean and Six Sigma can definitely help you do this. It started in Motorola when Bill Smith and Michael Harry, they wanted to improve the processes in Motorola, and they wanted to help the CEO. CEO had a dream of improving his company by 5 times, and the whole team supported them, and including Bill Smith and Michael Harry. Bill Smith and Michael Harry, when they showed some of the good projects they had done in the last 2 years, Bill Smith said that, why don't you encourage everyone in the organization to do such kinds of improvement projects? And to make it happen, they devised Lean and Six Sigma training. And they would say that, people who get certified in all the tools and techniques and also do the project, they will become a green belt or a black belt. Motorola receives the first Malcolm Baldrige Award, which is the highest quality award in the US. And GE's Jack Welch was also so much impressed with this methodology that he told his employees that if they are not green belts, they will not be promoted. So everyone wanted to be a green belt, and that's how it spread around the world. Well, now that was a brief history of Six Sigma. Now let us see, and those who have joined late, I'll repeat, Lean and Six Sigma is a way of improving your process by using projects approach. So process is a repetitive activity, set of repetitive activity, and project is a one-time endeavor. So you are doing a project in a process. Lean is about reducing the waste, and Six Sigma is about reducing the variation. So let me talk about first reducing the waste. So reducing the waste means we have 7 or 8 types of wastes which are not visible to naked eye, but they are hidden in our processes, like waiting time. Waiting time is non-productive. It wastes everyone's time. It is non-value added activity, because waiting is an activity, by the way. So it's non-value added activity. Then transportation, moving the things from one place to another place, which the customer is not willing to pay for, is a waste. Over processing, doing the things more than needed, customer is not willing to pay for, customer doesn't need it, but still you are providing those facilities, services, or products to the customers. That is over processing. Inventory means work in process inventory, raw material inventory, and finished good inventory all are waste. It is exactly money stuck in your processes, which is not delivering any results. Then you will say that some little bit of inventory is required. Yes, inventory, minimum inventory is required, but not. You can always reduce that. Rework, rejection. So these are all some examples. Maybe I'll start with some examples from healthcare industry, because I see a lot of people from healthcare are there. Later on, also I will tell you towards the end how typically organization implements Lean and Six Sigma. So here uh, I was talking about the wastes. So waste is nothing but anything which the customer is not willing to pay for. So I did one of the projects in fact, I've done many projects in hospitals in Saudi Arabia, right from King Fahd Medical City to International Medical Center to uh, the SABIC, Aramco, and uh, Riyadh Bank, Nakel, Utham, so many. We have done lots of projects there. I have more than 100 clients in Saudi Arabia and Middle East, UAE, Qatar, uh, Bahrain, Kuwait, etc. Now, taking an example from a hospital, these are some of the steps in the blood test process, and you'll be surprised to know that walking to outpatient department, the customer is not willing to pay for. Registering an OPD is not adding any value to the patient. So, what are the value-added activity? Only two activities are value-added: drawing the blood and processing doing the blood test. Even I would say they are also not value. See how do you identify the value? Uh, you have to first see what the customer is, what is the value customer is looking at, what exactly the customer is trying to achieve. They want to know their health status of health. Is that what is that they want to know? Yeah. So if they're getting the right status of health of their health without any test, also that's also fine. One day will come when they don't have to uh, prick the needles. Always, you'll get everything, all the results of your health, etc., on a monitor or some smartwatch. That day is not far away. But anyway, let us jokes apart. Here in this process, if I look at the given technology, only two of the steps are important or customers are willing to pay for, and we call them as a value-added activities. See, now some of you will be for some of you it will be very difficult to digest this particular fact that 70, 60, sometimes 90% of the time we spend in wasteful activities. Let me give an example. 80% of the nurse calls in a hospital are from they are from housekeeping related activity. My pillow cover is dirty, my bed sheet is dirty, etc. Nurse is not there to take care of these activities. For that, some other people are there, but people call nurses for this. That's waste of their intelligence. Yeah, because they are there to give you the medicines that take care of you. They'll forget the medicines if you make them indulged in other activities. So this is known as waste of intelligence. Similarly, some more examples are given here. I'm not going to describe each and every example, but you could double the cardiology lab capacity, reduce the diagnosis to exam time drastically from almost 2,700 minutes to 64 minutes. You can cut down the admission time from 17 minutes to 5 minutes, and you can reduce the signatures. That's what we did in many hospitals. So these are some of the case studies. So ultimate idea is to reduce the waste and deliver only value. So some more examples of waste: unnecessary process motion, unnecessary waiting, unnecessary transportation error, and unnecessary stock productions. Try to make a guess. Where is the waste here? Okay, I'll help you. See, any person who's not doing or being utilized, who's not doing any work or who's not being utilized is a wasteful resource. Or a person who's waiting, that's also a waste. And equipment which is not being used is a waste. Yeah, on a on a lighter note, cost of a 5-minute MD walk, $6. Some funny statistics. Walk to elevator is 1 minute. Elevator wait is 3 minutes. Elevator travel is 1 minute. Walk to lab or pharmacy is 1 minute. So in total, nurse cost per hour is $50. Cost of one trip is $5. Cost of 5 trips per day per nurse is $25. Cost of elevator wait per day per nurse is $12. So this is how you calculate savings. If you try to reduce some of the activities or eliminate some of the activities, you can definitely improve the profits of the company. Lab and pharmacy is on second floor, radiation equipment on ground floor. So people and patients and doctors and physicians, nurses, everyone will be making movement within the organization, which is of no use, no value, unless, of course, you want to do some exercise by walking. But otherwise, it is not delivering any value to the patient. Okay. So everything should be on the same floor. Any interruption is a waste also. There's a concept called Pukayoke, robust process design, smart heparin infusion pumps, but they can't go deliver quantities beyond a certain limit. Normal range is 0.001 and 0.01, and abnormal values cannot be entered here. So I'm giving a sort of a range, like if someone by mistake gives the prescription with beyond this range, it will be automatically rejected. Oxygen and nitrogen cylinders, they are their connections are different, if you have noticed, because you should not be able to put nitrogen in oxygen and oxygen in nitrogen by mistake. So with this, we call it as pokayoke. Even by mistake, you cannot commit a mistake. We call this as a pokayoke. In Japanese, we call this pokayoke, means even by mistake, you cannot commit a mistake. Sometimes people also call it as foolproofing. Even a foolish person cannot commit a mistake. Some examples here: fixed number of gauge packages during surgery, complete catheter kits for exertion, and a prepackaged medication cart with correct dosage. These are some of the and you can see in the chat box, we had also given, we will keep giving you some of the links. You can always watch these links. There are excellent videos which are explaining all these tools and techniques. You can further study as well. So this is about, so Pokayoke, I've given a very good example in that. And you can just so see that video in a spare time. Now, how would you create, you have to create an infrastructure of so let me show you how typically the Lean Six Sigma journey works. See, first, now I'm giving you the ideal journey. It's not necessarily all ideal always. So we do have deviations, but ideally, if you give me an organization to implement Six Sigma, what I would do is I will collect the improvement opportunities from every business, improvement opportunities from different businesses, and we nominate. So we create an infrastructure also where we have steering committee, some senior management, quality leaders as well. And then champions, they meet. Champions are the sponsors. So let me explain those terms as well. So green belts and black belts are the people who are doing the project. Yellow belts are the people who have not practiced the tools, but they have attended a session. They have seen those tools being practiced. They are yellow belts. Like, for example, I can call you as a yellow. Now, the real thing comes from the green belt and black belt. So I'm introducing you to the green belt today. Green belt topics and some of the things, some of the ways to improve our processes. You'll be seeing this. Here, the master black belts, like here in this case, I am the master black belt. And so they will guide and train the green belts from the organization. And if they want to go for black belt, they can also get black belt. So they attend trainings, they learn the tools, and then they take up projects. Green belts can take up improvement projects and make a huge difference to the organization's bottom line. Black belts also can do bigger projects. They have understood more complicated tools and techniques, and they can always help you to achieve your goals. Champions or the sponsors. Sponsors are the champions. They are the people who are head of the departments in whose process we are doing the project. And there are champions or sponsors are generally head of the departments. And the green belts and black belts could be anyone who is interested in learning. There's one more designation called process owner. Process owner is the manager of the process in whose process you are doing the project. So let's say if I want to reduce the recruitment cycle time in a company and I want to do a project. So the recruitment manager will be the process owner, and the head of the recruitment department, he would be the champion or the sponsor. Then if you give me an organization to implement Lean and Six Sigma, I would choose, I'll choose some of the projects from every department to get those list of possible projects. We circulate a list, and then we invite the senior management. So here I am seen doing a training in Switzerland for a manufacturing company. So they undergo an orientation. The senior managers undergo an orientation program so that they understand what is to be expected from Six Sigma, and they can also keep helping us in building the whole cultural change. So here, I'm just giving some examples. So here we had one organization. Their sponsors and the champions. They have given nominations of these people, and now they are in the classroom and they are doing the project. So so here people are together. They're coming, and yeah. So yeah, actually, uh, and once that is done, let me because my access was not showing audio. I don't know if that has been changed. Yeah, so I can't share the sound actually in the video. Sorry for that. Um, some setting has changed, or I don't know what exactly has happened. But anyway, so these people, they have now started the projects, and then once they complete the project, they are able to uh, present the project to the senior management, and then so he's telling about his project, and that's how typically the bank manager is who did the project. He's telling about his project, and similarly, this is CEO of Nakel, a logistics company. There, he's talking about how Lean Six Sigma transformed their organization from a local organization to an international organization. And I'm not sure. I don't think you are able to hear the video or the audio, but that's what he's telling. And all these, already have these videos listed there in our YouTube channel, so you can always go through. Okay, so now having understood this part, let us go back. Let us go back and start learning some tools and techniques. So I did talk about lean part, the first part, where you're doing a Gemba investigation. Gemba means go to the field, go to the place of action where the action is. So now when you go to the field, you'll find a lot of waste is there. That's what we did in identifying the lean. Now, if I go to the Six Sigma part is more about reducing the variation in your services or products. So if you you want to get something done from some of your service provider, and you tell them that I want your services, they say within 24 hours by 8 a.m. today or 8 p.m. today or whatever time, the person will be there at your home. And he actually does come. That means he's reliable, no variation. And every time you call, one person from that company definitely solves your problem at the right time. So we call this company as having less variation. Yeah. So this is consistent behavior. So less variation means better behavior. People, the customers don't like the variations in the services. They ask us that give me the time by when I can complete my particular job, or and when I can receive this particular job which I've given to you. And if you tell them, if you uh, uh, if they tell you the time, or if you tell them the time, and if you always adhere to that, it builds up your image. So variation is something which you're not able to uh, stick to one particular type of behavior. Variation is there. Okay. Just wanted to check how many of you uh, have undergone some basic training in Lean and Six Sigma. Anyone, just let me know in the chat box. So this is yellow belt, green belt, black belt, and master black belt. I'm talking about these terms. I've been using this since the beginning of the program. Yellow belt is the person who can who knows the tools and techniques, but he can support green belts and black belts as they do the project. But green belts are the people who actually do the projects, and black belts are the people who do a better project, end to end, with bigger projects. Master black belts are those people who are um, conducting the training programs like me, or who are consulting the training companies as they move along. Green belts is a 3 days training program. It is spread over usually the weekends, Fridays and Saturdays for Saudi, and Saturday and Sunday for other countries. Black belts are the people who have more knowledge, and they can do bigger projects. So that is black belts. And then we have master black belts also, as I was telling you. So let us start doing a project. Now, the whole idea is to do a project. So we'll be using some of the tools like CPHQ charter, type of data, normal distribution, control chart, etc. And also, let us see. I'll try to apply as many tools as possible to an imaginary, not imaginary. Actually, I did this project in 2011. So how a team would follow DMAC. So let us see, and let us start the project. So this company wants to reduce the recruitment cycle time of engineers. So when you want to do a project, you follow DMAC. I told you already. Define, measure, analyze, improve, and control. So in the define phase, you just write the problem statement and a goal statement. You also write project charter as well. And also engage with the teams who are part of your project. Once that is over, then you go and measure. Measure means measure the existing or extent of the problem. What is the extent of the problem? You have to measure how it is impacting the organization. Then comes analyze phase. So based on the data which we have collected, you will you typically find the root causes, and some of the tools to find the root causes we are going to discuss today. So let's just talked about define, measure, analyze, improve, and control. Improve means once I know what is the root cause. So now we have done a root cause analysis. In the analyze phase, we know what is the root cause of our problem. Then after that, we suggest some improvements or solutions. And if we implement, or if it's implemented by the hospital, they can reap huge benefits. And this after improvement, don't forget to sustain the gains, because sometimes we improve something, but it falls back to original state after some time. So it should not happen that way. So you have control phase. Control phase means you would like to hold the gains. Whatever you have improved, you would like to sustain it for a long, long time. So the define phase, you generally make a SIPOC, a VOC, or charter. So let us see what are these tools and how they have been applied to this particular project. So if you remember, I told you what is the definition of a project. Project is a one-time endeavor, and here in this case, we are doing a project to reduce the recruitment cycle time. That is our measure. And process name is recruitment process, and sponsor or the champion is the HR director. Process owner is recruitment manager. Person who's responsible for the recruitment. So first you begin with the SIPOC. What is the full form of SIPOC? Supplier, input, process, output, and customer. So first list down what are the basic 5 to 6 steps in your hospital. And then after that, you after the we are talking about the recruitment process. These are some of the basic steps you do. And the output of the recruitment is the onboarded employee or recruited employee, to be very precise. And who are the customers? Customers are the departments. And what are the inputs? These are the inputs. Now, a measure. See, in Lean Six Sigma, we believe that you cannot improve if you cannot measure. Yeah. So now I want to improve this process of recruitment. So what are the critical measures on the output? So one of the measures is, of course, the recruitment time. So recruitment time, what I'm trying to improve, we call it as Y. We designate it as Y. So here recruitment time is the Y. That's the measure on the output. And the measure on the X factors. This is the measure. These are the X factors. The measure on the X factors. So these are all known as X factors. So the recruitment time is delayed because of maybe IT system is not working, job description is not available, CVs are not of high quality, or the time taken in those processes, it is too much. So that is why maybe that's delaying our recruitment. Okay. Now let us, before I proceed further, let me introduce you to the basic concept of what is what are the two types of data. So these are the typical responses. People don't like to collect the data or work with the data. There's so many excuses for that. But no, you can't improve if you cannot measure. How can you measure? That is the certain things which you feel may not be able to measure. So I'm going to tell you how to measure everything. I'll give you the tip. So some of the rules to follow in Lean Six Sigma is you can't improve if you cannot measure, and you can measure everything. That's the second rule. So there are two types of data: continuous data and variable. Continuous and variable are same. So continuous data and attribute data. So continuous data is represented on a number line. It could be any number on a number line, starting from minus infinity to plus infinity. And it has to be whole numbers. So this is known as continuous data. Attribute data is something which we feel we cannot or we cannot measure. That's what we feel. So we can still put a measure. So if I just give me a few seconds, I'm trying to open one of the slides. So just was discussing about types of data, and let me play a video. So although audio, I will give the voiceover because the video right now is not, I can't play that video. Uh, but
So it was easy. So in short, in measure phase, you are telling the organization the current performance of your CTQs. In order to understand the measure phase,
so CTQ is critical to quality characteristic. Yeah. Is the measure which you are trying to improve. So in our project, can you guess what is the CTQ? I'm trying to reduce the procurement cycle time. So I jump into the, let's say, uh, as I do a project, means we want to reduce the recruitment cycle time, so we want to do a project. So we so before we proceed, let us do some basic statistics. I'm sure everyone knows what is mean or average. So that's what you should be knowing. There's another way of measuring the central tendency. We call it as mean and median. You can also use Minitab. It's a software, or you can also use an Excel sheet. It's also software. I was talking about types of data. Let me first talk about that. So these are some of the examples.
Possibility of a decimal.
So these are some of the examples of the continuous data. Age, height, cycle time, procurement time, recruitment time. And what is the attribute? Measure of attribute. So here you can say,
they can be expressed in decimal points, and also they all have a unit. Now let us talk about attribute data. Attribute data can be expressed in categories, and categories can be counted. Say, for example, if you want to measure happiness, so easiest.
So here I'm trying to measure happiness, right? So easiest way to measure anything, any attribute, is to create categories. So here for happiness, I can create happy or unhappy, presence of that particular.
Measure attribute data is to create a category, and if possible, you can create a binary category. A presence or absence of that attribute can be one of the simplest categories. So if I take the example of happiness, two categories I can create: happy. So if I want to increase the happiness in the employees in the organization, then I can always count how many employees are happy. Let's say 60 employees are happy and 40 employees are unhappy. I can express this as proportion. That means proportion of happy employees in my organization is 0.6, and proportion of unhappy employees is 0.4.
So I hope you got the point here. See, you can't have 60.1 people happy. So that is why it's also known as discrete data.
This is what that is very important to know the difference between continuous and attribute data. And it is very important to understand what is continuous data and what is attribute data, because
Okay, so I think any questions here? What is continuous data and what is attribute data? See, you can see, notice when you are talking about attribute data, there's only count. There's no, uh, you know, when we are talking about attribute data, it's always count like 60 or 40 or 61 or 62. You cannot have 60.1 people happy. So that's one of the distinctive factors, and proportion also. Proportion you can create out of your any count. So proportion is 0.6 and 0.4 here. You see, notice. And you can also have a percentage as well. So you can always make one more column 60% and 40%. Any questions? Yeah, are you able to hear me? Yeah. Yeah. So now let us see. Yeah. Now let us, let me take you through the project. So when you are in the define phase, you also write a project charter. Project charter tells you what is the problem which we are trying to solve, or what is the area of improvement or opportunity for improvement. Yeah. So here, if you see, the problem statement mentioned is that recruitment cycle time of engineers is approximately 50 days, which delays the client deployment and results in revenue loss. So what is the goal statement? To reduce the recruitment cycle time of engineers from 50 days in December to 30 days by July 2028. And approximately, you are going to save 300,000. Okay, great. So now we have completed the define phase. Any questions? Feel free to ask. Now, in the measure phase, you collect the data on the why. I hope you still remember what is why. Why is something, why is that measure, which I'm trying to improve. Yeah, it could be waiting time, it could be infection rate in hospitals, it could be errors in any company. These are all symptoms that something has gone wrong. Delays, customer complaints, etc. These are all why. But if I want to solve the why, I need to go to the X factors. So the factors which are influencing the why are known as X factors. So you start collecting the data. Once you start collecting the data, it should be having some sufficient size. So 100 samples is good enough. Actually, 30 samples are also good enough. And you can collect the data and find what is your uh, performance level. Now, depending on how you're performing, your 100% quality will make you Six Sigma process. No defects you are making. That becomes a Six Sigma project. Like it achieves the Six Sigma level after improvement or before improvement. So the Sigma level calculation is not in the scope of our session today. I'm just introducing you to some of the green belt things, green belt uh, related tools and techniques. And also, we are having a Ramadan batch. During Ramadan, we'll be running a batch in the night. Probably in your time, it would be somewhere from 9 p.m. to around 12 p.m. or 12 a.m. in the night. So we are going to run those uh, 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 greenbelt training programs during those. And if you are interested, you can always get in touch with us. So now continuing with we collected the data and we also calculate. We display the chart. We display the cause and effect diagram. We display the histograms of the data. I'll show you how it is done. I'll give you a brief overview also. We also calculate the sigma level. So describing sigma level calculation is not in it doesn't come into the introduction part of the green belt, but uh, as you go do the complete green belt course, you know how to calculate the sigma level. So high sigma level means very less defects, and customers are also very happy. In the analyze phase, you can take two doors. Process door means you do the as is process map, means how the steps are looking today. Then you do a Gemba walk. Gemba walk means you take your team members and walk with them in the work area where you want to make improvement or give suggestions. So that is also known as Gemba walk. I hope you still remember. Gemba walk means going around and looking for wastes in our process. And we identify the value added and non-value added activities. Similarly, let us look at the data door. We start with the cause and effect diagram, control impact matrix, Pareto chart, and some box plots and scatter plots. And let me show you. First, you start with the process map. So you now will give the detailed process map. In the initial stages, the process map was in the SIPOC. If you remember, we did a basic 5 to 6 steps. More focus was who's the customer, what are the requirements, etc. But once you have established, once you are in the project, once you are doing a project, then in such situations, you start, when you are entering into analyze phase, you will try to analyze each and every process, every step. It can eliminate, can simplify. So it is also known as escape analysis. Escape analysis, eliminate, simplify, combine, automate, and parallel. So identify the areas, identify some of the improvements, that all these tools and techniques that trigger. So here they are doing a brainstorming session on the recruitment cycle time, and then they will publish it, and then it goes further rounds of introduction. Whenever here you are trying to brainstorm on all the possible steps and also evaluating whether the step is value added or non-value added activities. Then here in data door, you are making a cause and effect diagram. So cause and effect diagram means you invite everyone in the process who knows this process of recruitment, who's involved in the process of recruitment. Invite everyone, then tell them to write all the possible causes, whatever causes come to their mind, they should write it. So they're writing, so many causes have come in, but I can't work on each and every cause. So I filter them down to Pareto by using Pareto chart. So Pareto chart is it goes by the name of Italian economist who found that 80% of the money was with 20% of the people. And similarly, today is also true that 80-20 rule is always true. So we are talking about Pareto. So many causes are there. So I can use dot voting, red dot voting. I can ask people, what are the reasons you think, like top 5 reasons you think could be could be anything related to man, machine, material, etc. Samir is telling, can you provide a certificate of this program? Yes, we can. I'll tell you how to get the certificate. Yes. So we have voted for all the causes with the help of the team, and then we find that some of the causes are mostly voted for. So here you can see upfront CV screening is a problem. Negotiation process is a problem. Package and facilities is a problem. These are our top reasons. Then you can further analyze certain rules. I'll show you box plot and scatter plots. Let me show you the. Yeah. So this is the data sheet. So this is the recruitment time baseline. Baselines means the initial recruitment. It's taking 52 days, 47 days, 50 days, 54 days, typically for different positions. So you can always make a histogram whenever you're having one column as continuous data and one column. So here, yeah. So here one column is continuous data right now. So I can use a histogram. So stat, basic statistics, and you can see graphical summary. Yeah. So I will make a histogram and it shows that, see, most of the processes, they follow normal distribution. So in Greenbelt program, I teach really normal distribution in little detail. For the time being, I can just tell you that a normal distribution is an expected distribution. It is normal to obtain a normal distribution, and that is why it is also known as a normal distribution. Say, for example, if I plot the data of age of all the people who are, say, presently attending this session, uh, I can easily find the average, and I can also find something called a standard deviation. If you see here, standard deviation. So mean is 50 and standard deviation is 5. Now, once I've identified and displayed the chart, what I will do, I'll brainstorm with the team. What is the man-related causes, machine-related causes, material-related causes, measurement-related causes, environment-related causes. And I invite everyone. I'm doing it in different way. Earlier in the photograph you saw, you can physically do it. Physically, you can call the meeting or you can do it remotely also. So so these are the causes they have mentioned. So yeah. So cause and effect diagram I can make. Now I have made um, I have made a list of all the causes. So now I have got my cause and effect diagram. So delayed recruitment is happening due to these so many reasons. Which reason is occurring most? In the chat box, you can see chat. If you want to learn in detail about cause and effect diagram or fishbone diagram, also it is known as, you can click on the link and learn some lot of things about cause and effect diagram. Now I have clubbed together here all the I hope you are able to see. Yeah, so these are all the reasons. So I can just do something. So see, right now I'm not teaching you how to do it. I'm just showing some demonstrations. Quality tools, go to quality tools and click on Pareto charts. And it will count how many times a particular cause is appearing, and it will create a project chart. Sorry, the Pareto chart. So assessment time, job description is not available, approval time, and firing. These are all ingredients or X factors for Pareto chart. You have heard of Pareto chart before? Okay, some people, okay. Badur is telling, yes, you have done it, okay. Murlidhar is telling, no, okay, not used, okay, no shoes. Any questions on interpretation of Pareto charts? So here, assessment time, so many people felt like that assessment time is the root cause. Then second was job description not available, and third was approval time. Now I can attack the assessment time and job description availability and improvement time. Now I can further validate these root causes. So now I have put all the data here, approval time. So recruitment number something had approval time of 17 days. Job description was not available in the initial stages. And similarly, type of hiring is related to the client. So don't worry about it. And assessment time and recruitment time. So for each and every patient last Sunday, or whenever, you can say whenever you're getting time. So you collected the data. 30, 40 samples are good enough. Collected the data and you can start analyzing the data further. Let us say recruitment time. Is it getting impacted by approval time? So I want to see. Now recruitment time is continuous data. Approval time is also continuous data. So let us see, are they correlated? So I go to basic statistics, regression. Or rather, let me start with the scatter plot first. So let me do the graph. Yeah, first. So when I'm dealing with, say, both are continuous data, I can use scatter diagram, scatter plot. So I can see here scatter diagram. So is recruitment time affected by the approval time? So if I see a pattern, see if I see a relationship, see as the approval time is increasing, uh, this recruitment time also is increasing. So in this such situation, I can say that, yeah, uh, there's a relationship and I can say if I reduce the approval time, if I work hard on changing the process of approval, it is definitely going to reduce the recruitment cycle time because they are correlated. Any questions here? Okay, great. So I can say here approval time and recruitment time, they are correlated. So if I work on reducing approval time, it will impact my overall time. Now let us see recruitment time and assessment time. Assessment time is time taken to assess the CV or assess the student, assess the uh, you know the proposal of that particular recruitment. Is it related? Assessment time and recruitment cycle time. So here also you can do a graph because scatter plot. Assessment time. Is it affecting the recruitment time? Now here there is no relationship, that doesn't all scattered. There's no pattern. So it is like saying that assessment time, if you reduce also, it will not impact, it will not reduce the overall recruitment time. There's not much. So we are getting the root causes based on the data. This is a Minitab software, which I can give it to you once you join our courses. Uh, Batul is asking, is there FFT and is this SPSS software for extracts? It is Minitab software. Yes, it is Minitab software. So recruitment cycle time. Let us check. Is it getting affected by the job description, job available? Say description is available or not available. So for those cases where the recruitment time was high, what was the situation? So let us see one by one. Here, because job description is attribute data and recruitment time is continuous data, I cannot use scatter plot. I will use box plot because one is continuous, one is attribute. Now, looking at this, if you see the recruitment cycle time, when this is our recruitment cycle time, which is the Y, the X factor here is the job description. Available, not available. So when it is not available, we can see the recruitment time is also very high. When it is not available, recruitment time is high. And when it is available, recruitment time is less. So here I can say that job description availability is very critical. It straight away reduces almost 10, 20 days from your whole process. Yeah, so I hope you got a little bit of picture about how we are validating the root causes. Now, once we have validated the root causes, here I can say the job description availability is important and it's very something which this box plot can be held, helped, or sorry, box plot can help you to understand the, you know, this is the X factor, right? So this is attribute data. Job description is available or not available. It is attribute data, and this is continuous data. So continuous and attribute data, they cannot, you know, here I can say that there is no relation. Sorry, there is a relation. There is a relation. If the job description was not available, you take more time. So I got my root cause, and I will see whenever I get a root cause, I will suggest some solutions for that particular root cause. So if you see, now you are going to go to the improve phase. So improve phase, you will get there are certain rules of brainstorming. Two, three important rules are defer evaluation, means don't evaluate the idea immediately. Fantasize freely, yes. So I hope some of you remember these rules of brainstorming. I think you must have read by now. So, uh, idea is a bad idea. Fantasize freely. Defer evaluation. Generate quantity. Do not worry about quality. Generate quantity. Do not worry about quality. So now you generate the ideas. So if you see in the chat box, we have given you box plot video also, 635 brainstorming technique. Let me tell you 635 also. Six three five. There's a technique called 635. I've given a link here. You can always watch. But briefly, I'll tell you what is 635. 635 is a technique where you are generating solutions. So here, what you do is you get hold of six people. Now, why six? It can be five also, but for the time being, let's imagine you get six people together, and once you get the six people together, you give them a written form. So it's a silent brainstorming technique. So you get this kind of paper and give it to each and every person, and they should give an idea for a particular cause which are you doing right now, which you think are the reasons, or which think they're like. So here you're filling in the paper. So, and all six people are filling in their own papers and exchanging the paper so that others can read what they have written and they can generate new ideas. So you see, when you read other people's ideas, it generates new ideas in your mind. So I've used this technique in many organizations. Okay, so once we have got, now we have to control. Control means you have to sustain the gains. You have to. So I just, and I can give you some examples. You have to here create new SOPs, new standard operating procedures, and also you can do the. You can also look at the control charts, and also you put before and after. So here they have given some improvement ideas for each of the root causes, whatever root causes they found. And then once you got the root causes and their ideas, they need to be implemented in the next 6 to 7 months. And then once it is implemented, then we move to another project. And why? But before you leave, you can always put some control actions in place, and what are the controls where something goes wrong. People are going back to their original habits. Then you have to introduce certain new things, and you can always ensure that it is followed. That is what is control phase. So before the time was 50 days, now it has become 26 days. And savings is around $760,000 from this project. And this is a graphical representation of so before and after, you can see clearly there is a drop. Okay, now let me ask you some questions. Can you tell me the inputs to a processor are called what? What do you call inputs of process? X or Y or out of scope? Yes, axis. Inputs are X vectors. Yes. The output of a process is yes. What the customer sees. It's A, yes. It's A. Yes, it is what the customer sees. Yes. Which of the following is not a deliverable of the DMAC analyze phase? Which is not a deliverable of DMAC analyze phase? Yeah, it is solutions. C. Solutions are not in analyze phase, they are in improve phase. Okay, so we have been conducting training programs around the world. And if you would like to become one of the most valuable person in your company by applying process improvement statistics, if you can answer the whole question. Okay, so if you would like to become a master black belt or green belt or black belt, here are some questions for you. Um, can you share some of the dates? There are certain dates. You can always join any of those days. We have got Friday, Saturday, Sundays batches. We have got next weekend batch starting on January 25th or February 22nd. Okay, great. So please join. Okay, Badul is telling yes, you'd like to. You can also watch my other LOL training program videos because I have talked about separate topics there. So every introduction to green belt, I keep talking about different topics. Yeah, and look at the pricing as well. You can always have a look. If you are taking more than more than one or one of the certification program, you can take lots of you good discounts. So please do feel free to connect with us for the project. And these prices are only for you because you have attended the session today. So immediately, if you'd like to, uh, connect with us or register for the program, you can always do so. Okay. These are the timings also, timings if you can show. Okay, so a lot of yes, here we have done lots of program. Can you play this video, please? In your, I can't hear. We can't hear anything. Audio was not clear.
Have to say, courses that transform careers and empower individuals to succeed. But don't just take our word for it. Hear what our students have to say.
Yeah, the course that we did was a week-long online facilitated course. It was fantastic. It showed us the whole methodology behind Lean Six Sigma, and it also provided a various amount of tools that we could be able to use to improve all of the existing processes that we have here in the park.
Well, it was 1 week training. It was very interesting and always energetic in terms of interaction in the class. Every single day has been different, and the knowledge sharing has been remarkable.
It was a very stimulating experience where we met every day with the colleagues, all very engaged, eager to learn, and keen on and willing to actually pause, step back from their day-to-day work to get some new perspectives. So it was really refreshing.
I'm the business development manager in IMC International Medical Center. It was a great honor and a pleasure to have attending this course. It's really interesting, a lot of value adding, a lot of new concept and technique we have learned during the last 5 days. It was really, really impressive.
Hello, we want to introduce our group. We are the pioneers and we believe we can fly. We just completed the Green Belt Six Sigma training with Mr. Amitabh. We enjoyed the course a lot. It provided us with very productive and useful knowledge about statistics, about the Six Sigma and the MIC and the SIPOC and everything.
My name is Adil Rahman. I'm from SATOP. I would like to thank SATOP overall the team, the opportunity to all of us to have a very good practice session with one of the best mentor and guides in the field of Six Sigma. And this would really help us as a team.
Us in the Six Sigma journey last 1 year. We've had multiple projects getting across various units within operations, and it has been a learning journey, very smooth and enlightening for all of us, especially me.
On-stream analyzer. I attended this 5-day Six Sigma course, and really it was not only useful to understand what Six Sigma is, but also as a general methodology for process improvement. Many tools I learned through this course, and I'm really sure that I will be able to use these tools in my day-to-day.
Hello everyone, future CPHQ professionals. I just want to give you a bit of an idea of our last 3-day course on the CPHQ exam preparation. It was awesome. We covered the majority of the topics in a very targeted and focused way that allows us to later on focus our studying and our energy and our time
So just wanted to check how many of you are interested in, joining the session. And now, we'll send out all the details of our sessions, future training programs, and you can join whenever you would like to. There are different options. The timings are also given here. The timings, if you see. So choose your relevant time. Weekend batch is different. Evening batches is different. Morning batch is different. If you are joining a morning batch, 2 hours morning batch, evening batch. Yeah, so here, now these are the different combinations. If you want, you can go ahead. Yes. So now, any questions? You have any questions? I will be happy to answer the questions. So these are Ramadan night batches. Yeah, Ramadan night batches specifically tailor-made for Ramadan. In the evening after 9 p.m. you can start the session. By midnight we'll get over. So around within 5 to 6 days you can become a green belt, and it will help you to improve your processes. Also get a certification. Worldwide the certification is valid as a green belt certified holder. You can also further upgrade yourself to black belt after that. Okay, great. Thank you. Thanks a lot. And do watch my another trainings like yellow belt training also, where I have given you some statistical knowledge about some tools and techniques. So thanks a lot.